Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
For centuries, ancient cultures knew the secrets to longevity, vitality, and healing. Now, modern science is catching up. Ageless Blueprint is a podcast that will reveal the modern secrets of better health and a better life. Join Dr. Eldred Taylor here today and every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. As together we discover the secrets to better health through science and spirituality. A better life with Ageless Blueprint starts now. Here's your host, Dr. Eldred Taylor.
Hello, good morning to everyone. I am Dr. Taylor, and this is Ageless Blueprint, and I'm Dr. Taylor, and my new name is the Spiritual MD. And if you haven't seen my other podcast where I tell a little bit about my story and my history, well, I'm the son of a Baptist minister, and I grew up in a Christian home, and I decided to go to medical school because I was interested in science. And so I have this kind of dual life that I'm interested in spirituality, but I'm also interested in science. And way back in the 1600s, this doctor named Rene Descartes, he decided that, yeah, there actually was a spiritual part of everyone, but there was also the body, and the body was just like a broken clock. And you could totally fix the body and you didn't have to worry about the spirit. And they let the church handle the spirit part. And then philosophy and medicine, they were only supposed to be focused on the body. Well, through my understanding, my recent understanding, you really cannot separate the two, okay? In Chinese medicine, they honor the spirit, then they honor the mind, then they honor the body, okay? So that's the last thing, because you have to start from the top down, not from the bottom up. So I'm going to bring back what Descartes separated, all right? So I'm the Spiritual MD, all right? And I started this Ageless Blueprint because when I went to Egypt in December, I really began to understand spirituality and how spirituality has been passed down through the ages. I mean, through thousands and thousands of years. It's like the humans have always wanted to believe in something higher than themselves. And I think that's what motivates the body. That's what makes the body want to do something, makes it want to have a purpose. So I think in order to live a full life, you have to bring those three things back together. We have to understand how the spirit controls the mind and how the mind controls the body. And so we want to have the right spirit. That gives us the right frame of mind. And then that gives us the right physical expression of all of those three. So what separates those three? Well, I think the primary thing that separates the body and the mind and the spirit is stress, right? We wrote 2 books. We wrote the book, Are Your Hormones Making You Sick? Talking about how a disconnect or imbalance in the symphony of hormones and how they work together, that causes a lot of problems. And then we began to understand that even if you fix hormones, if other things are out of balance, if there's other stressors, and it doesn't necessarily have to be an emotional stress, it can be a physical stress. And anytime your body is out of balance, it doesn't have what we call homeostasis. Your body sees it as a stress, okay? So what we want to do is we want to understand stress. And that's what I had to do when I became interested in functional medicine, is that overall I had to understand stress. And now I think we wrote that book over 20 years ago. Now I see that it's really becoming popular, that people are talking about stress and talking about mental health. And so I'm happy that that's that's happening. I was trying to do that 20 years ago, but I didn't have these types of avenues to talk about this. So this is an old lecture that I've brought new again. I went around the country and the world talking to lay people and talking to physicians, trying to get them to understand the impact of stress. So Rebel, let's pull up the slides, and I want you to understand stress. I'm not trying to make this as a teaching thing. When you see PowerPoints, you're like, oh my God, he's going to teach me something. No, I I want to empower you, because when you understand what's going on with you, then you can change. If you don't understand, it's a stressor when you know something is wrong and the doctor keeps telling you that there's nothing wrong. Okay. You know, the doctor keeps saying you're not sick, and you know that you're not well. So let's try and break up this frustrating relationship between doctors and patients. And when I began to understand stress and understand that that was all most of the time the root cause of things, I began to like my patients, okay, because I understood them and they understood me. So let's go. So now, first thing, it is very important that you have a good self-image. And a lot of times people carry around these things that they think are diagnoses, but they're really not. They're just a description of the issues that you have. So that's what we're going to talk about, because I don't want you to go around saying, I have this, I have that, I have this. No, you need to have a healthy self-image. Don't let someone, even if they're a doctor, put a label on you. You need to label yourself as healthy no matter what is going on. And that's how your mind can control your body. If you think one thing long enough, your body will respond. And if you think negatively about yourself, your body will respond to that also. Does that make sense to you, Rebel?
Yes, it definitely does. It seems like that mind power is something to start with.
Yeah, yeah, because you can't change your body if you don't change your mind. You have to, for you to go to the gym, your mind has to say, this gym is me going to the gym is going to improve my health and it's going to improve my life. You have to think like that. Okay. So even though you're 50 pounds overweight and you can't do one push up, you have to think that you can do it. And you'll end up doing 2 push ups, then 5 push ups, then 10 push ups. But if you go in there and you keep saying, I can't do a push up, you will never, ever, ever do a push up. Okay. So, anyway, all right. So, let's go to the first side. Is it a diagnosis or is it a description? All right. So, here's what happened. This is what I'm talking about when you start to not like your patients. Okay. And so, hey, it's just, you're my special group here. So I'm going to give you some behind the scenes secrets that happens in a doctor's mind in the office. Okay. So you have a patient comes in and she says, hey doc, I'm fatigued. I'm nervous. I'm irritable all the time. I feel depressed. I can't concentrate. I'm apprehensive about everything. I'm afraid of everything. I don't want to adventure out and do anything. I'm just frustrated all the time. My life looks like it's going down the tubes. I have this weakness in my legs. I have these food cravings, and sometimes I get dizzy. And then you say, okay, wait, okay, all right. So I got those symptoms. Is there anything else? Well, yeah, doc. I'm lightheaded. I have some. I can't sleep. I have insomnia. I have this PMS the week before my period. I start crying all the time. I hate my husband. I think about divorcing him, and it's just crazy. I have these headaches, and I have these muscle pains and spasms, and I have this
2
pain in my
questions. Are all
what?
of these happening at the same time or randomly throughout the
No,
time?
no.
Or
Let me tell you. You'll have these patients who they fill out the medical history and they check every box, and you just say, I don't even know where to start. And this is before I understood stress. Doctors don't even know where to start. Okay. So they got all these check boxes checked. Okay. And so the doctor he just goes back to what's familiar to him. Okay. And everybody's had this. So what happens? Well, the doctor orders a bunch of tests. The FSH, that looks at whether or not you're menopausal or not. You look at your thyroid. You look at your blood count. You look at everybody. Has everybody, Rebel, have you seen all of these labs being ordered? Or these are just the common labs? When you go into the doctor and say, we're going to order routine labs. And this is what
Dr.
they will
Taylor,
order.
I avoid doctors except for you.
I guarantee you that anybody's listening or who will listen, they've had this full gamut of tests run. And let me tell you this, the doctor knows that they're going to all be negative, and the patient knows they're all going to be negative because they've been to 5 different doctors and they've all done the same test. All right. So the doctor has to go back. So you're going to come back in 2 weeks, and the doctor has to tell you the results of those tests. And he's looking at your lab results before he goes into the room, and he says, oh my God, her labs looks better than mine. And so he goes in the room and he has to tell her, hey, I don't see anything wrong with you. And so then the patient goes through all those symptoms again. But doc, what about this? What about that? What about this? So here's the next thing that happens. He orders all of these imaging tests. Oh, you need an ultrasound. You need a CT scan. You need an MRI. You need an upper GI endoscope. Now, you know what upper GIs and endoscopes are? That means they stick a long tube down your throat and look down your stomach, and then they stick one up your butt and look up the other side. Okay, so you've been poked and prodded in every orifice that you have. And now, here's what the doctor gains from that. Now, I told you these are the behind-the-scenes secrets. It's going to take at least 6 weeks for you to schedule all of those. So thankfully, he doesn't have to see you for another 6 weeks and hear you complain about all of those symptoms. Now, I'm telling you, it's not conscious that the doctor is thinking that, but subconsciously, that's what he's thinking. So now it's 6 weeks later, and oh my God, he or she showed up again. So now what do you do? All right, you go in and she says, doctor, they had to have found something because it took me, I don't know how long to get all those tests done. And then I got poked and prodded. I got things stuck up here and down there. Oh, it's got to be something wrong. And he says, unfortunately, there's nothing going on. So then you have to pull out the big gun. You know what the big gun is, Rebel?
No, I don't know.
It's called visitus interruptus. This means, how can I get out of this room so that this patient will stop complaining to me? So you have to write a prescription, okay? That's how you get out of the room. So what prescriptions are you going to write? I was hoping this wasn't going to show up. So you're going to write for Lipitor, lisinopril. You write for all of these different drugs. You write for drugs for their thyroid and for pain and for Prilosec for their epigastric pain. And I wish I could get that, but you get all of these drugs, okay? But you still feel like this guy right here, okay? He's popping pills, and look at him. He looks a mess. All right.
It looks like he's questioning, why am I taking all of these things, and why do they work together, or are they contradictory to each other?
Exactly. And that's what happens. And when you go to a doctor, I remember I told you you've had those tests done like 5 or 6 times. Well, every time what happens, a doctor adds a new drug. And so now you've got these 10 drugs, and you look at those different pills, nobody knows how they interact with each other. Haven't been any double-blind placebo-controlled studies to say, hey, how does the blue pill and the green pill and the yellow pill and the white pill, how do they all work together?
So he's taking all of that handful of pills, and he still has the symptoms.
Exactly. He still has the symptoms, and he still has that underlying knowing that this is not the answer for me. All right. So what is the problem? Well, the problem is that popular thinking doesn't require you to think at all. So those are the popular tests that the doctor does. Everybody does those tests. Everybody, if you're listening to this, somebody's had an MRI or ultrasound because somebody saw something on a mammogram of their breast. So then they get a biopsy, then they get an MRI, then they get another biopsy, and they go on and on and on. Because it's easy to do what other people do and hope that they thought it out. Why do you get those routine tests? Remember that see one, do one, teach one? Hey, that's what I saw my residents, my upper level residents, that's what they ordered. So I ordered the same thing. They ordered the MRIs and the CT scans, and I did the same thing. They wrote prescriptions. I wrote prescriptions. I thought that they thought it out. They were smarter than me. They were at a higher level than me. So, hey, you don't question authority. That's what I thought. But I don't think that anymore. And I don't want you to think that. You always question authority. All right? Now, this is the crux of this, okay? Is that you have all of those pills, but you really don't have a diagnosis. Because remember, all the tests, they're normal. Okay, so what do you have to do? Now you have to come up with a description of a disease, a disease that fits the description. Okay, so really, there's not a diagnosis. So let me just give you this example. All right, Rebel, you've heard of people having chronic fatigue, right?
I have.
And people probably tell you, hey, I have chronic fatigue, so I can't do this, I can't do that, I can't do this because I have chronic
So they
fatigue.
get an excuse not to try anymore, and they just
Exactly.
get stuck in a rut.
Yeah, so let me tell you how that gets diagnosed, because there's no real test for chronic fatigue. So here's how you diagnose this. A patient has to come in and say, hey, doc, I am just tired all the time, and I don't understand why. So the doctor listens to you for a while, and he says, well, hey, obviously you have chronic fatigue. Well, what does chronic mean? It means all the time. What does fatigue mean? Tired. So you tell the doctor you're tired all the time, and you know what he tells you? You're tired all the time, but he names it chronic fatigue. And you walk around saying, I have chronic fatigue. What you wanted to know was, why do I have chronic fatigue? So, Rebel, have you ever heard anybody say I have fibromyalgia?
I have.
You know what fibromyalgia means? Fibro. So let's say, here's how the patient has to come in to be diagnosed with fibromyalgia. The patient has to say, hey, doc, every muscle and joint in my body hurts. You say, okay, well, you know what fibro means? Fibro means fibrous tissue. That's what your joints are made out of. The MY is for muscle, okay? And the algia means pain. So you say, hey, every joint and muscle in my body hurts. And your doctor says every muscle and joint in your body hurts. Fibromyalgia, joints and muscles hurt.
So, in other words, they're just giving you fancy names for what
For
you told.
what you just told them. Exactly. That's what I'm saying. You don't have a diagnosis, you have a description. So then you come in and you say, hey, doc, I'm depressed. And you know what they add to that? ION, and they say you have depression. Okay. So when you say you're depressed, you want to know, why am I depressed? Why does every muscle and joint in my body hurt? So then you come in and you say, hey, doc, I don't know what's wrong with me. I can't concentrate. I can't calm my brain down. Just everything. I can't pay attention to anything. And so what does deficit mean? It means you have a deficit in your attention. That's what you just told the doctor. I can't pay attention. And he says, okay, yeah, you have attention deficit. So then you say, all right, doc, I don't know what's going on with me. I get this constipation, and then I get this diarrhea, and then I bloat, and everything I eat seems to upset my stomach. And it just seems like my bowel is irritated all the time. It's just irritated. And everything irritates my stomach. Isn't that what irritable bowel means? Didn't you just say my stomach is, and they say you have irritable bowel, and people walk around and they say, I have irritable bowel, and they wear it like a badge of honor. And then if you come in
Because
and
they
you
know
say,
what it is called now, or they have a better name for it.
how many people have you heard say that they have these issues? I mean, I hear it. I was like, so that's why I'm talking about your self-image. And if you create that self-image, you're going to always have chronic fatigue. You're always going to have pain in your joints and muscles. You're always going to be depressed. You're always going to have a difficulty concentrating.
But you're
Your
telling
bowels,
yourself this, and you got
exactly.
recognition from a doctor. So now you're telling yourself this. Your doctor's telling you this. So you tell yourself more. How many times has a doctor just added these things? Like, okay, well, I got this, and this. Okay, well, you fit in this pile. I got this, and this. Well, you fit in that pile.
And you walk out thinking that you had some benefit. You didn't get any benefit. And you're always going to be stuck in that rut. And you're always going to be going from doctor to doctor. You're going to tell them that you have chronic fatigue. They're going to be familiar with that name. And then they're going to give you an antidepressant. They'll give you Adderall or whatever. Okay? So you want to get away from this. These are really not diagnoses. Okay? I'm going to tell you what your diagnosis is. Your diagnosis is stress. That's what it is. So how do I know this? I'm going to tell you, this is a study in 2002. If you look at the bottom, you'll see this is a study in 2002. This study changed, well, I remember I told you about that patient who told me about saliva testing. Well, that changed my life. And then this study changed my life because it says, now this is in 2002, and I'm going to give you the updated statistics on this. But 43% of all adults suffer stress-related adverse health effects. Now that's gone up since then. I'm going to show you those. But this is what caught me. 75 to 90% of all visits to primary care physicians are for stress-related complaints or disorders. That's higher now, but 75 to 90% is anytime somebody walks into your office, 75 to 90% of the time it's going to be stress-related. So I thought to myself, hey, I can be right 75 to 90% of the time if I focus on stress. So I decided I'm going to be a stress expert, okay? And that changed the course of my life, and that's why we wrote a book called The Stress Connection. Stress has been linked to all the leading causes of death. So if I want to prevent death, then I need to be a stress expert. An estimated 1 million workers are absent each day with stress-related complaints. So this is causing a problem with our gross national product, with our productivity. Stress is responsible for more than 25 billion workdays lost annually. Now, look at that number. It's 25 billion. Let me show you the updated ones, okay? So now 62% of global adults, remember it was 42%, 62% of global adults report stress affecting daily life. Stress is linked to the major, we talked about that. High stress can reduce your life expectancy by 2.5 years. So you're going to die 2.5 years earlier if you don't deal with this stress problem. 1 million workers are absent daily, but remember it was $25 billion a year. Now it's $210 billion lost just due to stress-related disorders. Now, this is really, I won't say surprising, but it's really sad. 25% of Americans burn out by age 30. By age 30. So why are these kids committing suicide? Why are they on drugs? Why? Because we are stressing out our kids. Hey, look, when I grew up, you went to school, you did like an hour of homework, and then you went outside and played. Okay. I mean, we didn't have AP classes. We didn't have all these extracurricular. We went outside and we rode the bike and threw the football and all this stuff. Now kids are stressed from the day they're born. They got to get into the right kindergarten. They got to get into the right elementary school. They got to get into the right charter school. It's crazy. 25% are burnt out by 30. Now, I'm used to treating people who are burnt out by 50, but now it's 30. And we see kids in our office who they have to drop out of school because they're so stressed. These are these straight A students that are pushing. And by the time they get to the 10th or 11th grade, they are totally burnt out. And we can do that with cortisol saliva testing, and we see it, okay? So Gen Z and millennials report the highest work stress at age 25. 70% of Americans have financial anxiety, and I guarantee you that's gone up since all of these changes with the federal government, and I've seen those patients too. Only 14% of adults are in therapy, despite rising awareness. And common coping tools are music, hobbies, sleep, exercise, social connections, and they don't say here, but drugs. But I think that a lot of our drug epidemic, and especially in teenagers and these millennials, is because they have just grown up in stress. And so stress seems normal to them. And it's only so long you can deal with that stress before you want to escape. And that's the good ways to escape it is with music and hobbies and sleep and exercise, but then there's bad ways to escape this also. So if you haven't figured it out yet, stress will kill you. Okay, it'll kill you 2.5 years earlier. It can kill you with drug addiction. It can kill you with suicide. All of these things, stress will kill you. All right. So if you don't want to die early, if you don't want your body to continue to deteriorate because the root cause has not been treated, then you need to understand stress, and you need to do the 4 things I talk about. Is 1, get rid of the stress. Again, if it's, and we're going to talk about that after the commercial. We're going to do a commercial here in a minute. Is get rid of the stress, whatever it is, if it's a relationship, if it's a job, whatever. But then you also have to get rid of the stresses that you don't know about. All of the imbalances, the imbalance in your gut, the imbalance in your hormones, the imbalance in your emotions, all of those. So 1, get rid of the stress. 2, if you cannot get rid of the stress, you have a sick child, you have a job that you just have to have, then you have to change how you respond to the stress. All right. I had to change how I respond to the stress. I'm trying to do more of this type of stuff. So I had to take away the stress of having to constantly be at the office. I had to take an extra day off so that I could develop new things. All right. So then the third thing you want to do is you want to repair the damage caused by the stress. If the stress has damaged your gut, you need to repair it. If it's damaged your adrenal glands, you have to repair it. If it has damaged your cardiovascular system, you need to repair it. And then the 4th thing, you have to prepare for future stress, because you're going to have some more stress. Life will give you more stressors, and you have to be ready to change how you or respond differently to that stress, to not let it cause damage to your body. And you have to be prepared to handle that stress. All right. So
So
let's
you
go
need
to
better coping mechanisms?
Yeah, you need better coping mechanisms. And what I didn't understand in the past is that meditation is the key to changing your coping mechanism. It's the key to changing your identity. If you want to get away from that chronic fatigue identity, or that irritable bowel identity, or that attention deficit disorder identity, it is all about meditating. What you have done, you have connected these neurons to think the same thoughts. I'm tired. You have to get into meditation, clear your mind of those thoughts, and you have to let new thoughts re-enter. So yeah, the coping mechanisms of the music and the hobbies and all of that, that's great. That's kind of a distraction. But what you really want to do is to change your mindset. Okay. You have to change your mind, how you think about yourself. And a lot of times the meditation takes you into the spiritual realm. All right. So now you have a higher power helping you to change your mind, and that's helping you to change your body. All right. So that's how those 3 are connected. All right. In order to make a change, you have to go a level higher. And then sometimes you even have to go a level higher than that. All right. So let's go to a commercial, and then we're gonna talk about understanding stress even on a more body physical level. Okay.
We are going to a quick break, so stay with us as we explore the Ageless Blueprint right here on W4HC Radio and Talk4 TV. An ancient secret with a modern twist for better health and vitality. Dr. Taylor will be right back. Taking care of your health shouldn't mean taking a handful of pills every day. At Taylor MD Formulations, they create doctor-developed supplements that combine the best natural ingredients so you get the results you need with fewer pills. Taylor MD Formulations is backed by science, designed for real life with real results. Less pills, better health, doctor approved. Shop now at TaylorMDFormulations.com and discover smarter supplements for smarter health. That's TaylorMDFormulations.com. We are back for more of Ageless Blueprint. Once again, let's join Dr. Taylor for more insights and research on the ancient secret to better health and a better life in modern times. Here's your host, Dr. Eldred Taylor.
All right, I'm back. I'm Dr. Taylor, your spiritual MD, and we are going to continue because I got 20 minutes and I want to get through these slides. All right, so here is the first book that I read probably 20 years ago, Why Zebras Don't Get Ulcers. And that helped me to understand stress. So I'm going to quickly summarize this. All right. So if you're a zebra in the wild, and I actually went to Africa in 2014 and we did a safari. So we saw some of this. We saw zebras. We saw so many zebras. You get tired of seeing zebras. It's an amazing trip to go to Kenya and Tanzania and see the Great Migration. It was like being live in Lion King. It really was. But anyway, so you see how the animals, they have predators and they are set up. Their stress response is don't get eaten. Okay. So when they see a predator, or if they see another zebra who's trying to muscle in on their family and their wife and children or whatever, they know that they have to fight or they have to run. All right. So that's a stress to most animals. Because see, they're not thinking about who's president. They're not thinking about how much money they have in the bank. They're not thinking about how they hate their mother-in-law. They're not thinking about any of that stuff. They only have one stress: survival and thriving. Survive and thrive. And that is your basic instinct. All your body wants to do is to survive. All right. So anyway, so they either have to fight or they have to flight. Okay. If the predator is too strong, they run. If they want to fight it off, they can do that. All right. So what do you have to have? Well, the blood pressure has to go up because they have to get more blood to their muscles. They have to increase their heart rate because they have to get that blood to the muscles quicker, and they have to get oxygen there and take the CO2 away. All right. They have to have harder contractions of the heart. The blood flow has to go to the muscles. You can't be worried about digesting and all of that stuff. You got to get all your blood flow to the muscles so you can run or fight. You get dilated pupils, so you have better peripheral vision. You have your bronchial tubes open up so you can increase the input of oxygen and get rid of the CO2 faster. You get increased muscular strength. That's why these women can pick up cars when their child is injured. You get release of glucose from the liver. So you got all this sugar coming into your bloodstream, and you have increased mental activity, but you're going totally on instinct. You're not creating anything. You're not thinking about the future. You're just thinking about how do I save my life? And you get an increased metabolic rate. All right. So because they need to run fast, they need to fight hard. They need to have quick energy. All right. So they get this flood of glucose. They need to be lightweight. You know how they are lightweight? They empty their bowels. Okay. So they don't not carrying around any extra weight. So that's why a lot of times when you get nervous, you feel like you have diarrhea because your body thinks you got to run and fight. You have to think quickly. So you have to go on instinct and you have to block pain because even if you get injured, you got to keep running. All right. So what you don't need if you're a zebra, you don't need to worry about reproduction. So your hormones get put in the back burner. You don't want to have insulin resistance. You're not trying to store energy. You're putting that glucose out there because you need it right now. Now you want everything to be run on cortisol. You don't want your thyroid to be activating things that you don't need. So it shuts down your thyroid. You don't need to be wasting energy on trying to digest food right then because you got to use the energy that you already have stored up. So you stop digesting food. You don't want to waste water, so you actually hold on to water because you want to have more blood volume, so it's less likely you're going to bleed out if they cut an artery or a vein. So you're actually trying to hold on to fluid. And then the last thing you want to do is is fall asleep while you're in the middle of a fight or you're in the middle of a running away from your predator. So for a zebra, that all makes sense. You want that stress response. It just makes perfect sense. But that's why zebras don't get ulcers, because here's the thing. If you win the fight or you win the race, then you're going to go back and graze and just hang out and do zebra stuff. All right. So your cortisol is going to go down. Your stress level is going to go down. If you lose the fight or if you lose the race, you're going to get eaten. And you know what happens? Your stress response stops. So either way, you're going to have a quick on and off of your stress response. Okay. So that makes sense. Now, the problem with us is that you don't have to see the predator. All you have to do is think about the stress. You can think about your boss arguing at you that morning or every morning. You can think about your mother-in-law coming and living with you. Okay. You can think about the bill collector calling you, and you're going to turn on the stress response. And we turn on the stress response 24/7. But what happens is you get the threat, you get that biological response. Your all your blood's going to your muscles, it's going away from your stomach. It's doing all these things that should happen if you were going to run or fight. But it doesn't stop. And so now you have this continuous threat, this continuous abnormal biologic response, and that's going to lead to symptoms, and that's going to lead to illness. All right. So the stress response is great when it's used properly. Okay. You're picking up a car off your kid. Yeah, you're not worried about the future. You're not worried about digestion. You're not worried about anything. You need all that energy to go into your arms and legs to push that car up. But then that's just going to happen for about 5 minutes at the most. Then you're going to say, "Oh my God, I'm so happy," and and the stress response goes away. All right. Am I making sense, Rebel?
Yes, most definitely.
Okay. So here's what happens. All right. You're sitting at home eating dinner, but you're stressed out because your boss yelled at you. So your blood pressure goes up, your heart rate goes up, you get increased heart contractions, and we call that panic attacks. Okay. You get increased blood flow to active muscles, and this is why your muscles hurt. If you put a lot of glucose in the system and you're needing to run and fight, what happens is that glucose goes down this pathway called lactic acid. And lactic acid is what builds up when you go and work out in the gym for an hour. I did leg days Saturday and my legs still hurt, okay, because of lactic acid. All right. So even if you're thinking about this and all of this glucose is going in your muscles are going to hurt even though you didn't run or fight. That is fibromyalgia. All right. You get decreased blood flow to areas not needed for rapid activities like your kidneys and intestines. So you're going to hold on to water. So you might have swelling and you're not going to digest your food. You're not going to get the energy that you should get from your food. And then also you can have diarrhea because remember, you're trying to be lightweight. So you get this diarrhea. I need to empty out my bowels even before I digest my food, because what happens is it slows down your stomach and it speeds up your colon. So you get diarrhea and you also get this indigestion because you're stressed and your body says it's not time to digest. Your pupils dilate, so you look like a crazy man. You talk about crazy eyes. You get dilated bronchial tubes, you increase muscular strength. You're getting the strength, but you're not using it. You get release of glucose from the liver, so that shoots up your blood glucose, so that can increase your risk of diabetes. You get increased mental activity. That's your attention deficit disorder. You're paying attention to everything because you're trying to figure out where to run or fight, okay, or where to run from, where should you go and run? And then you get an increased metabolic rate, right? So all this is happening and there's no predator around. And this is why we wrote the book called The Stress Connection. I know you can't see this, but just believe me. Stress is connected to every organ system in your body. It affects your brain. And that people come in and say they have foggy thinking or they can't pay attention. It affects your skin. You ever broken out in hives because you were so nervous? It affects your muscles and joints. We just talked about that. It affects your heart. It affects your cardiovascular system. It affects your stomach. It affects your pancreas by pumping out too much glucose. It affects your intestines by slowing down the upper part of your gut and speeding up the lower part of your gut. It screws up your reproductive system because your hormones are out of whack. And it primarily screws up your immune system. And that's what increases your risk of cancer. You have these things called natural killer cells that come out when you are relaxed and when you are asleep. And if you're not getting good sleep, you don't have those natural killer cells that are finding cancer cells before they ever show up in a biopsy. And so it increases your risk of cancer. So everything is connected to stress, okay? 75 to 90% of the time, If you think it's stress, you're going to be right. Okay. So here are all the stresses that we're dealing with 24/7. We have the stress of the pollution that's in our air. I live in Atlanta, Georgia. It's a big city. So every time I walk outside, I'm breathing in something that's stressing out my immune system. We have these deadlines. Hey, I got to be on this podcast at 9 o'clock every morning. It's a deadline. I got to have my slides ready. All right. Heat, these different temperature changes. Here in Atlanta, it can be 50 degrees one day, 80 degrees the next day. We overload ourselves with all of these things we have to do. These parents who have to take their kids to all this travel baseball and travel basketball, and then they have to make A's in school, and then they have to get into the right school. Then you have to go on a college tour and all of this stuff. We always are dealing with family relationships, okay? You know, sick parents, sick children, all of these things. Everybody's concerned about their finances now. We're dealing with death of our parents and death of loved ones. And then we're dealing with illnesses with kids and friends. So all of this, these are examples of the stressors that we're dealing with, and they don't go away. You have to be able to rise above all of this noise that's going on in your life. And you have to be able, and this is where meditation comes in, quiet your mind so that you can think about how you can change these situations or change how you respond to the situations. When you are in the middle of the fight or in the middle of the flight or the escape, you are not thinking about how to change your future. Okay, so because you're thinking about this all the time. All right, so what you don't need if you are a human, you don't need to run fast. You don't need to fight hard. You don't need quick energy. You need a steady flow of energy. You don't need to be lightweight. So you don't need to empty your bowels. You don't need to think quickly. In order to change things, you have to be contemplative. You need to think deeply, not quickly. And you don't necessarily need to block pain. Things you do need if you're a human. Even though you're dealing with your finances and you're with your sick kids and with your dying parents, you would still like for your reproductive system to work. But stress causes hormone disruption, all right? Even though you're dealing with this, you would still like to use energy efficiently. But that's what causes insulin resistance. We have all this glucose out, then your insulin, you become resistant to insulin because your body thinks you need all this glucose. All right. Then that gets stored as fat, and then you have a high hemoglobin A1C and so on and so forth. When you are under stress, it shuts down your thyroid. And I'm going to do a whole podcast or lecture on thyroid disease and thyroid dysfunction. But when you are stressed, thyroid function gets shut down. Okay. It decreases your metabolic activity because it's all going towards stress and trying to alleviate the stress. So you can have hypothyroidism or low thyroid function all due to stress. You don't need to worry about growing because you may not live past the next moment if you are a zebra. Okay, so you're not thinking about growth, so you're not trying to absorb anything in your gut. You just need it all to pass through because you got to keep running. You would like to have fluid balance. You want your kidneys to work well, and that can be a cause of hypertension. When you're increasing intravascular volume or you're increasing the amount of water or blood that's in your vessels, then that's going to create hypertension. It's too much fluid. That's why people are on diuretics, is to get rid of the extra fluid, and that decreases the pressure in your the high blood pressure. And then sleep. Even though you're worried about all these things, you still need to sleep. But that's what causes the insomnia. So why are you on these top 10 drugs? Well, how do you make cortisol, which is your stress hormone? You make it from cholesterol. So if you're stressed, you're going to increase your cholesterol, but they're going to give you Lipitor. But it's not a Lipitor deficiency. It's because you're stressed. Lisinopril is a high blood pressure medicine. I just told you why stress causes high blood pressure. I told you the Synthroid, that is a medicine for hypothyroidism, but stress can cause hypothyroidism. Gabapentin is for pain. Why do you have pain? Because you made this lactic acid in your muscles, even though you didn't work out. So people have this pain. And it's also, they have it for restless leg. Prilosec is due to the indigestion caused by stress because it slowed down your stomach. The Norvasc is another blood pressure medicine. So you have a lot of different blood pressure medicines because most people have blood pressure problems. Glucophage or GLP-1, that's to help with insulin resistance. So everybody wants a GLP-1. It used to be metformin. That was the drug of choice back then. Now it's a GLP-1. The albuterol and Claritin is to help your immune system. Those are for allergies. And a lot of times you have allergies because your gut is disrupted and that disrupts your immune system. And then you have Zoloft, and that's an antidepressant, so you don't feel so bad about how bad you feel. All right. So all of these top 10 drugs can be associated with stress. Now, does that make sense, Rebel?
It's what makes sense to me is question. There are no stupid questions. Ask why.
Yes.
And when they can't answer you or they give you a stupid reason, look into it for yourself. Because
Exactly.
it just doesn't mean that you have to listen to them. I'm not trying to be mean to the medical profession, but there's a reason for them and there's a not reason for them. And if the reason is I'm going to fit you in this and I'm just going to sell you what the pharmaceutical reps are pushing for me to sell you, then that's not how I want to be treated.
Right.
I want to know why.
Yeah. So here's the in a nutshell. Doctors are trained to diagnose and treat diseases. Okay. So if you have a disease, okay, let's pick any disease. You have, let's just say you have a heart attack. Okay. You have cardiovascular. So they do a cath and they see a blockage in one of your vessels. Okay. That's something they can diagnose. They can show it to you and they'll put a stent in or they'll give you bypass surgery or whatever. So they diagnose and they treat diseases. That's how I was taught. See, these aren't diseases. They're dysfunctions. And that's why
why? What caused it? What
exactly?
And how do you stop it?
That's what functional medicine is about. See, I just gave you a functional medicine lesson. I told you what is dysfunctioning in your body. It's not a disease, it's a dysfunction. Your gut is not functioning correctly. Okay, your brain is not functioning correct. What is causing that dysfunction? It is the stress, the imbalances that you have. All right. So if you have a functional problem, you need to do functional tests. Okay. So saliva testing gives me the function of your cortisol curve through the day. All right. I can do GI testing and I can look at the balance of the different bacteria in your gut. We can do a heart rate variability test and we can look at the imbalances in your sympathetic and parasympathetic nervous system, your fight or flight system, and your rest and digest system. And so what happens is we have an imbalance. We have this heightened sympathetic nervous system of fight or flight, and we have this suppressed parasympathetic. Because see, if there's a choice, your body's always going to go towards survival. Okay. It says we can rest and digest later, but we have to worry about survival right now. So then your constant state of survival, so you don't get any rest and you don't get any digest. And that's what people are complaining of. I can't sleep. I'm gaining weight and I don't know why. My bowels don't work. All of that list of symptoms is telling the doctor that they have a dysfunction. But if you don't understand functional medicine, you're not going to be able to help them. All right. And if you don't understand that body, mind, and spirit go together, you're going to have a hard time helping them also. So I know we're up on time and I don't know if we had any questions. If we did, Rebel will send those to me and I'll answer them on the next podcast. But I hope you didn't take this as a teaching lesson. I hope you took it as an empowerment that now you know what is going on with you. All right. And now you can seek out information that's going to help you to help yourself. All right. So I hope you enjoyed this. I hope you learned something. Please comment. Let me know what you're thinking. And I want to hear from you and I want to see you next week. All right.
Thanks for joining Dr. Taylor today. If you missed any part of this show, just check out the podcast wherever you listen to podcasts. Ageless Blueprint is every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. Together, we discover the ancient secrets to better health through science and spirituality made for modern times. Until then, feel free to check out agelessblueprintpodcast.com and taylormdformulations.com for more information.
All right. So